Good afternoon, prynawn da. My name's Rodri Walters from the Age Cymru project at Hafan Cymru. I'm joined here by Dr Di Lloyd, the chair of the Health, Social Care and Sport Committee at the National Assembly for Wales. And yeah, the Age Cymru project, we've now got 34 men's sheds across Wales, and it's a project basically which encourages men to set up and run and own their own community-based sheds, which is basically a tool to combat social isolation. It's to get people out of their house and back talking to other members of their community, finding out what's going on and just taking part in activities together. We often say the most important tool there is the kettle, because just getting together and chatting to people in your neighbourhood often gets you to find out about things going on in the community, but also getting men to chat about health issues or anything else which may be worrying them. So the Health Committee's new inquiry will look at the impact of loneliness and isolation, particularly in older people in Wales, and what can be done to tackle the issue. So why did the committee decide to look into this issue, and what are the specific issues that older people face in terms of loneliness and isolation?
Well, you covered some of them there, but why we specifically went for this amongst... we've had several inquiries so far, and several inquiries are also ongoing with the Health, Social Care and Sport Committee, so there's quite a fairly wide ambit there of possible inquiries, but we've had several representations. As Assembly members, we have several dozen emails per day, as well as letters and telephone calls, and lots of those are main issues. And obviously, we'd had some fairly powerful evidence from the Older People's Commissioner as well, particularly as regards the effect of loneliness and isolation. In other words, loneliness and isolation, as regards the impact on somebody's health, is right up there with smoking 15 cigarettes a day. Now, that's pretty powerful stuff, really, and there's never really been a proper inquiry about the effect of loneliness and isolation, and we felt we should get to grips with it because it seems as though we're all so very interconnected these days. Everybody's got a mobile phone, you're online, we're netting and we're twittering and whatever, but in amongst all that interconnectivity, sometimes what we miss out on is the face-to-face human contact. We're still social animals at the end of the day, and you can have as many telephone helplines or as many sort of email back and forth and stuff, but it's a social contact that enriches our lives, and sometimes we've actually lost that in this 21st century world when we think we're so interconnected, but actually we're not that interconnected, because you can be lonely in the middle of crowds, and that's where we're trying to get to, really. And it's, yes, this inquiry is basically about elderly people, because by and large it was the Older People's Commissioner that helped bring this to our forceful attention. But loneliness can happen at any age, obviously, and we're looking to take evidence from people outside that normal elderly care sphere, if you like, as well as regards as part of this very extensive inquiry here in the Assembly.
Great, thanks. Well, this discussion's been promoted across social media over the past week or so, and lots of members of the public have got in touch to share their ideas on how to combat loneliness and isolation. We're live tonight, so any questions we can field straight from the iPad here. Alice Saville on Facebook suggested that good community centres can make a wonderful contribution to alleviating loneliness and isolation. Tanya Strange on Facebook and Twitter mentioned a new service in Gwent, Befriending Me, to help combat the issue, as well as Liz Morrison on Twitter highlighting the Big Lunch Cymru as a way to bring communities together. So we'd like to thank everyone for the comments so far, and please feel free to ask questions during the discussion. So our own experience of Age Cymru tells us that community-based initiatives like these can have very positive impacts on health-related expenditure, like reducing GP visits and cost avoidance. Do you think there's any scope for encouraging government support to invest in community initiatives like these, with the aim of longer-term savings for the healthcare budget?
Indeed, I would. I mean, obviously, it needs to be planned and costed, and some sort of business plan to actually justify government expenditure, if you like, because we're in these austere times. Any amount of government spending has to be justified, especially if you're thinking about having some upfront monies, and then we have to justify by some global savings, possibly in another budget. So it's a difficult sell, that sometimes. I mean, I would concur with the health service contact stuff, because as you may know, I'm still a GP in real life, as it were, and for some people in the Swansea area, I'm the only person they see in a week. Now that is tragic, I've got to say. But you know, and that's quite a common experience for GPs, community nurses, health visitors. Sometimes it's just that one person calling around the house is the only person they see in a week. And people look forward to that. But, you know, as a society, that also says something about us, you know. Nowadays, I'm a GP in a very close-knit society in Penclawdd, and everybody knows one another. You know, it's a very static, stable society, traditional Welsh society, where, okay, you know, everybody knows everybody else's business. Some people are frightened of that. Some people think that's not good. Actually, when you're ill, it's good. You know, your relatives are there, your friends are there, everybody's round when you're ill, and it's nice to see that social cohesiveness working together wonderfully and positively in a community like that, especially when you're ill and you do need that help. You know, everything is there, it's wonderful, works well. Now that is, I've been a GP in other parts of Swansea, obviously, whereby people don't know their neighbours at all, and you don't get that sense of cohesion at all. And how, as GPs then, we deal with that illness, perhaps the same illness, you know, in different people, one who's got ample social support. So you say, yeah, it's perfectly logical to keep this person at home because there's a lot of help there. If somebody takes a turn for the worse, somebody can do something about it. Whereas if you're looking at somebody who's hasn't got friends or has just moved into an area, no network, no family nearby, with the same illness, you know, what tips you into thinking, well, actually, this is a moderately severe illness. We could keep this person at home, but we are actually dependent on some sort of social support. And where there is none, it tips us in favour of actually you're probably better off in hospital. Whereas that same illness in a different social situation would tip us into thinking, no, you're okay here, actually, because I have full confidence that the community, with adequate instructions, can take care of you.
And I think we've seen the same in men's sheds. Sometimes you just need someone to give you a little push to go and see the doctor, perhaps, or quite the opposite, you know, and just find out about national initiatives about prostate cancer or anything else there. You know,
oh, absolutely, because, I mean, yes, we learn about various illnesses and various screening programs or whatever, or we don't learn about them, you know, or sometimes we're in denial about whole sorts of loads of things that we should be doing something about from a health perspective. And sometimes you just need to have that sort of kick sometimes into action positively, and sometimes if you are worried about something but haven't chatted with somebody, you think, oh well, I was silly worrying about that, you know. So either way, you know, it's that social interaction that is the important thing, because as they always say, you know, problem shared is a problem halved. So and that certainly when people are ill or think they're ill or are worried about something, that is very much an important phrase to bear in mind.
When we're looking at the responses, the access to transport was a big subject of discussion. Susan Kearns on Twitter said that local government should be given the means to support our services with a settlement that helps to stop cuts or end lifeline facilities. As part of the inquiry, the committee is asking the public to give their views on the scale and causes of problems of isolation and loneliness. And to people like Linda Joyce Jones on Facebook and Janine on Twitter, who say that affordable transport services in very rural parts of Wales are a lifeline. So the question is, do you think isolation and loneliness disproportionately affects people in different parts of Wales, especially those in rural areas, for example?
It can do, certainly, in terms of the distances involved. That's why, you know, a bus pass is particularly liberating, I've got to say, you know, and obviously affordable community transport. There are various models in terms of book a bus and stuff in rural Ceredigion, I know. But yes, affordable, available, reliable public transport is particularly liberating. So I know my mother, who's in her 80s, with a bus pass now, that is completely liberating. You know, you have a bus pass in your handbag, off you go, you know. It's not really safe to drive anymore, sort of long distances or anything, but the bus and the little booker bus takes you wherever you want to go. Yes, it is liberating, and that's what the sort of service we want to see everywhere. So yes, sometimes that's difficult to organise in rural areas. It's by no means a cakewalk in urban areas either, all right, when it comes to overcrowded train services and things down here in the South Wales valleys. But yes, in essence, transport is all as regards liberating and making sure we stay connected.
Yeah, and I know my own experience, my grandmother used to view with you, the bus was the community centre almost, you know, the chats you have there is their shed, if you like. And
well, it is. I mean, I know several people who basically, the bus is the mobile men's shed, and obviously not restricted to men, but basically you go on a bus journey, you talk to whoever you sit next to, you spend some time in the middle of Swansea city centre, and you catch the bus home again. And that is your day, you know. And yes, absolutely, it's fundamental to because people who don't perceive themselves as lonely just don't appreciate what a knowing, nagging situation it is, that you're always trapped with your own thoughts, really, and everything is magnified to be far worse than it actually is. And time just passes so slowly. And when time during the day passes so slowly, just imagine how time during the night passes. So, you know, you are condemning people to a real drudgery. And there are things we could be doing about that. You know, I mean, lots of people choose sometimes, you know, the way that we live, but we should be making it easier for people. And one of those easiness things is actually public transport that is available and cheap.
Yeah. We've had some more responses in from social media here. Anne Wareham on Twitter says that some people enjoy being alone. Well, perhaps so, but our projects taught us that many community members can be reluctant to admit they're lonely, isolated or in need of some company. Tanya Strange on Facebook, we must start asking people if they're lonely and what they think would help. We have to stop asking what's wrong with people and actually support their strengths there. Yeah. So a couple of convergent views there. I guess the question then is, does the committee think that starting a national conversation around loneliness and isolation could start to break down any taboos around the subject?
Yeah, I think so, and I think by virtue of just having this review will start people talking, because obviously, you know, if you're going to say, well, actually, I'm a bit lonely, I mean, you know, that is a bit of a step to take. I mean, I take the point that some people actually want to be alone, and obviously we're not going to force services on people if they don't want them, particularly in a situation where, you know, services are stretched anyway. We're talking social care here or the health service, you name it. You know, services are stretched. We're certainly not going to force you to have a service if you don't want it. But I think we should enable people who've made that step to say, yeah, I am lonely actually. You know, people have passed away, family far away. There's all sorts of issues. Most of the time you can't do anything about. But let's see what we can do where you live, you know, in your Milltir Sgwâr, you know.
Right. Access to the internet is another key idea shared by the public. The Fair Treatment for the Women of Wales on Twitter said that online support groups are a lifeline, with Delith Gardner on Facebook saying we should help communities to access digital media. However, some people like Danny Boom, Robertson Phillips on Facebook, for example, talk about how young people are affected by isolation as they're very reliant on the online world. Yeah. We talk a lot about digital literacy. Is there a danger that digital literacy and access to digital technology can be seen as a magical cure for isolation and loneliness? And to what extent do you think it can actually combat isolation and loneliness in Wales?
Well, it's got a part to play. But like I said, it's the actual face-to-face here now, social contact is the big thing. Like I said, I've been a GP for over 32 years now, and the enriching experience for people, lonely, is actually talking to somebody in the flesh. Now, if you can't do that, obviously, various things kick in then, even a simple phone call, going online, Twitter, Facebook, all the rest of it, that's absolutely great. And when you can Skype, you know, that is face-to-face as well. Absolutely, but there's something about that being close, flesh, face-to-face, that is absolutely tremendous and liberating in its own way. And yeah, it's a very valuable point in terms of when you swing it over, and obviously some people tell me, yeah, the elderly people, they're not everybody's a silver surfer and all this, and not everybody's got access or would want access to a computer to do all this sort of stuff. They'd prefer the old-fashioned, let's meet for a cup of tea, which is fantastic. I would wholeheartedly go for that. But also, perversely, for our younger people who are always on something, sometimes we find that our young people cannot express themselves, can't do the small talk, if you like, you know, because to keep a conversation going, yes, you're going to have something fairly mesmeric to say, as I'm telling you now. Obviously, it's all mesmeric, obviously, but sometimes you've got to fill in the gaps with small talk. And what I've also found over the years, that if people are, digitally in tune with everything, great, and a bit of a keyboard warrior, fantastic, all right, within limits, but put them in a face-to-face situation and we can't actually fill in the gaps or actually present yourself at all well. I'm not looking at anybody in particular here now, but basically, you know, that is a challenge as well, and the ability to be able to communicate is more than just a passage of words. You know, it's about engaging people, and our young people particularly need to be confident doing that, and sometimes you're not going to learn that by being hooked up to your phone.
Yeah. I think we've seen that in the sheds as well, and challenging the assumption that perhaps older people are less interested in the internet.
Yeah.
A lot of our members are highly into the internet, but are just, as you say there, just seek the chance to go out and chat to their peers and find out what's going on then. Yeah. On the subject of the internet, we have another comment in from Facebook here, or from Tanya on Facebook. GPs need to be able to signpost people to befriending services. Prescription for loneliness at the Iron Bevan University Health Board, and its partners are working together to make our area a compassionate community.
Yeah, absolutely. No, I agree wholeheartedly with that, because obviously donning my GP hat now on as opposed to an Assembly member hat, I mean, roughly half the people I see don't have a recognisable medical illness wrong with them. There's all sorts of reasons for you attending your GP surgeries, and lots of it is to do with unhappiness, but a lot of it is about financial pressures, lots of non-specific things going on, and it's a particular challenge then, particularly people who are attending all the time. The challenge to me as a GP saying, well, am I sort of missing something deep, or some unusual presentation of somebody who's going to turn out to have some unusual form of cancer or whatever in about 2 years' time, or are we actually just dealing with somebody who just wants somebody to talk to, you know, and just wants to have all their worries and concerns explored and explained and reassured, you know. And that's the particular challenge of being a GP sometimes, in terms of deciding, we have a sort of gut feeling, we call it, of whether actually this is going to turn out to be an illness that we should be doing something about urgently, or whether this is just a situation we are going to just talk to you at intervals, just to make sure that I've got the measure of your personality, and actually you've got the measure of my personality as well. Because as you'll have noticed, I'm a bit of a shy, shrinking sort of person, and it's difficult to get to know me sometimes as a GP, you know. And basically, you know, we have to have a sort of personality relationship thing going, so that trust is built, and people can come with any sort of issue and ask my advice, and I advise them as this person who's just been doing this sort of advisory stuff for over 30 years, you know. And that's why medicine is as much of an art as it is a science, you know, and it's where that sort of communication stuff comes in. But yes, we need all the help. I can't, you know, deal with that. Every single person who has an issue, loneliness, whatever, yes, signposting, and there are some excellent services out there now, and we are developing more community hub services, certainly in the Swansea area, whereby we can passport people to the nearest, certainly voluntary sector service that will deal with your issue.
That's right. Our project's based at Age Cymru, and we work in partnership with the Choices project at Aberystwyth University. And they say one issue is that it's usually people with the resources to contribute towards consultations like this who actually do so. So what other ways will the committee use to try and capture the voices of older people to ensure you get a cross-section of the population? Yeah,
and that supposition is quite right, which is why certainly in this assembly, as you recall, I'm quite old now, so I've been an Assembly member for many, many generations. But in this Assembly, all the committees are going out on things like Twitter and Facebook, asking people for ideas for reviews and stuff. And sometimes we actually hold ballot. One of the other committees I'm on, the Culture Committee, has actually held a vote. You know, what should our next review be? You know, and it's music and education, because that had the most support online. But also we do visits, community visits, and committees do go out to meet specific groups, and we do so as individual Assembly members as well. And you could always, that good old-fashioned thing, you know, where we used to have paper, and then we used to have a pen, and we used to write on it and stuff, and then we used to find an envelope with a stamp on it. We still welcome those as well. Okay. Well, our time's up, unfortunately, so a huge thank you for joining us tonight. If you'd like to take part in this inquiry or share your experiences about isolation and loneliness in Wales, the consultation is open till 10th of March 2017. You can follow the committee on Twitter at Senedd Health, or go to www.assembly.wales/Senedd Health to take part. And if you're interested in the Mensheds Cymru project, please check us out at menshedcymru.co.uk. So thank you very much for your time tonight. Great. Diolch yn fawr. Thank you for joining us. Cheers.